And welcome back. Once again, we're dedicating the bulk of this hour to taking your phone calls, your reaction as it relates to the coronavirus. And to do that, we are very thankful to be joined by Dr. Felipe Serrano, a regular here in the last few weeks helping us navigate this. Dr. Serrano, an emergency room physician with the Mount Sinai system. He's also assistant professor of emergency medicine as well. Let's start first with what you're seeing inside the ICU, and then we'll get to the phone calls, Doctor. Have you started to see this flattening of the curve we keep hearing about? Because every day we hear a record number of fatalities, but we're also hearing Governor Cuomo saying we are starting to see things at least start heading in the right direction.
Yeah, I mean, I think where we're seeing a little bit of the flattening of the curve is with new diagnoses, which I think is what that means. We're seeing the volume in the emergency department stay fairly steady, right? So for a little while there, every day we were seeing more and more patients coming in with symptoms, and we were creating new ways to see patients in different ways we hadn't seen before, because in order to deal with the increased volume. The number of patients in the hospital still is very high and keeps increasing because we keep admitting people, which is why I think you're seeing the number of deaths going up. But the number of new patients that we're seeing sick coming in, at least in my experience in our hospitals, has been at least steady, if maybe slightly declining. I don't want to kind of call that too early over the last couple of days or so.
And I can see one of the callers, in fact, I'll bring her in now, but it's going to be the question I think we're going to get a lot is, when do we go back to normal? In fact, let's bring in Janice. Janice is calling us from Northern Virginia. And Janice, I think you speak for many. I assume you want to know where we are with this right now, and when do we get back to the America we were used to?
Yes. And one more question. Is O negative a factor for the coronavirus?
Thank you, Janice.
Hi, Janice. Do you mean the blood type?
Yes.
Okay. I don't know of anything that has shown that your blood type will affect how the coronavirus affects you. The coronavirus really attacks the cells in your lungs more than anything, and that doesn't really have to do much with your blood type. There is some question that the coronavirus affects your hemoglobin, which is the chemical inside your red blood cells that carries oxygen. But I haven't seen anything that your specific blood type would affect how the coronavirus attacks your body.
But to that broader question about the return to normalcy, I don't know about you, but the fear I have, and later on this hour we're going to be talking to an epidemiologist who has studied, and he says fear, believe it or not, is a big component to this, not just the fear of the disease, but also some of the other fears that come out of this. But this premature, and if we go back 100 years ago to the Spanish flu, this idea that, okay, coast is clear, everybody go out. And then there was another second spike. For one of the legion of people in the ERs, along with the RNs and the other MDs like yourself, I would think that would keep you up at night, this idea that we send people out too early and there's another wave that comes crashing down to you guys.
It is a really big concern. And, of course, being in the healthcare field, we are on the side of keeping people in as long as possible, minimizing the number of cases, minimizing the number of deaths. And obviously this is much higher than my pay grade, but there's the other side, the economic consideration of opening business up for people to be able to earn a living. We are worried that next winter, there's going to be a resurgence of this virus, of the people who weren't affected initially. There is some concern from some societies that summer won't necessarily stop the virus, as we usually expect with things like the flu or the common cold. So we really don't know, and I think the biggest fear we have is the uncertainty of what's going to happen. You see, I think I was reading earlier that countries like Denmark and the Czech Republic are starting to open a few little businesses here and there. So I guess they may give us a little clue as to what happens when businesses start to open up again.
But isn't the unspoken thing, and I understand why originally we were all screaming for testing, and then quickly it went to ventilators because we missed our window for testing like they did in Singapore and South Korea, et cetera. But without the testing, we don't know who's already gotten it. In many cases, a lot of us may have already been exposed to it and built antibodies, but we don't know. And for those who actually did have it and got through it, there are certain people who are predisposed now that can go out back into the workplace. But until we have testing for everyone, we really are flying blind, aren't we?
We are in a lot of ways. I think I think we talked about this last time. We don't know whether we are forming antibodies. I think we are, right? I think it's one of those things where we are going to be immune to this disease. If we're not, this is going to turn into much more of a debacle. But yes, I think if you have had symptoms and were told it was coronavirus, you're probably okay to go back out. The tricky thing is going as a country to be able to tell people who can go out and who cannot go out, right? We don't have that kind of individual control over people. And so until we have sort of a vast majority of the population that's had it, or the number of cases has shrank to a certain amount, that the risk of respreading it to a large number of people, and that's going to be sort of our CDC and the health societies are going to have to figure out when that's going to be.
Right. All right, stay with me, Doctor. We come back, we're going to go straight to the phone lines and get more of your questions. Some of you already sent some online as well. We'll get the doctor's answers to them. You see the number on the screen. If you haven't joined us, please do.